The June 25th, 2014 meeting of the Agenda Charter Committee will now come to order. Will the clerk please call the roll?
Mr. Baroff? Here. Ms. Cayley? Here. Dr. Quattro? Here. Chairman Rocco?
Here.
Mr. Tucciarello?
Here. Is there anyone signed up for public forum?
Yes, we have several speakers.
Okay.
When I call your name, please come forward to the podium. You will have 2 minutes and only 2 minutes in which to address the committee. Please conclude when the buzzer sounds. Thank you. Our first speaker is Maureen Friedman.
Hello, and thank you for the opportunity to speak to you this evening in support of the proposed bill to enact a county policy to designate a room for breastfeeding and lactating in Monroe County operated buildings. My name is Maureen Friedman, and I'm a registered nurse practicing in Rochester in obstetrics and newborn care for the past 27 years and currently co-president of the Rochester Regional Breastfeeding Coalition, which is part of our New York State Coalition. Last week at our coalition meeting, we had discussed this proposed bill, and with the support of the coalition, I'm here to speak on their behalf. While there are laws in New York State to protect a woman's right to breastfeed wherever they want, whether at work or in the community, the message is being interpreted and embraced slowly across our state. Having a policy and leading by example would help communicate the message to county employees and visitors that women are supported and valued for their decision to breastfeed. Consistent with the message other community partners here have embraced in Rochester, as well as our City Hall last year. Breastfeeding is more than just a choice, it's a public health issue. Thus, showing support by having a dedicated area is valuable not just to breastfeeding moms, but to future parents, employers, and the public at large. The proposed bill tonight would make the statement that supporting breastfeeding is invaluable and it can help to change our Rochester culture, especially among our most vulnerable population, the low-income population, which have a frequent presence in many of the county buildings. Thank you for your time and consideration.
Our next speaker is Kim Tuck. Our next speaker is Ruth Lawrence.
Okay. Apologies for being late. I am Dr. Ruth Lawrence, a faculty member in the Department of Pediatrics at the University of Rochester. I'm a member of the United States Breastfeeding Committee and have spent my career encouraging breastfeeding in Rochester, in New York State, and around the world. The World Health Organization, the American Academy of Pediatrics, the American College of OBGYN, and many organizations have stated that babies should be breastfed exclusively for at least 6 months, and then for 6 more months while adding weaning foods. And the reasons are all ones you've heard. Best nutrition going, infection protection, allergy protection, obesity prevention, immunologic support, and improved intellectual development. Bartek from Harvard has shown that if 90% of all infants in the United States were breastfed for 6 months, we would save $13 billion in healthcare costs. In Rochester, 80% of the babies leave the hospital breastfeeding. But as mothers go back to work or move in the community, the rate drops quickly to 25%. Women need a place to feed their baby or pump their milk while at work so that every individual, every employee can meet the national goals. We have a pumping place at the university. The health department has a pumping place. The Monroe County legislative buildings and other Monroe County buildings need just such a place. As leaders of our county and a model for the community and other employers, the legislature needs to provide for its employees just such a place. It will save the county healthcare dollars, decrease the obesity rates, and provide our children with the best start in life. Thank you.
Our next speaker is Barbara Ann Maddle.
Sorry about that. Hi, I'm Barbara Ann Maddle, and I'm the CEO of Child Care Council here in Rochester. And I'm here to speak to you about the proposal for a breastfeeding and lactation space within county office buildings. First of all, I know you'll probably hear, and I can tell you about all of the health benefits, both to the child and to the mother of doing breastfeeding, and also the benefits to the county as an employer for making their employees more comfortable during that period of time when they are breastfeeding or needing to pump so that they can do breastfeeding. Those are the things that you'll really talk about. One of the other things that I want to talk to you about, though, is the fact that this is what I call a really good return on investment for the county. Our organization employs 56 people here in Rochester, and we have the distinction of always having at least 20% of our folks at some point during the year pregnant. We have about 4 to 5 births a year in our organization. Probably think that's a good idea because we're in the child care business, so we're supporting our own, which is true. But also when our staff came to us and suggested that we have a room like this, I looked into it purely from the financial aspect of it, looked at how much it was going to cost me to equip that room and set it up. And I have to tell you, the investment in these rooms is so minimal, and you get such a great benefit from it, that it's really something you have to consider. All I had to do was buy a chair, a lounge-type chair that I picked up at BJ's for less than $200, set of stacked tables so that there's some place for folks to put things. Actually, the people from the staff decorated the room, so they put pictures up and stuff like that. The room is the size of probably a walk-in closet. It was a storage room, and it just happened to be right next to the restroom area, so we didn't have to worry about plumbing to have a place where people can wash their hands. Basically, that's the whole thing. The whole investment you're making is going to give you a terrific return, and it will be something both the staff and the clients of the county who come to your facilities will appreciate so much you won't believe it. I really hope that you're able to do this. Thank you.
Our next speaker is Nancy Stephanie.
Hello, my name is Nancy Stephanie. I'm a lactation coordinator at one of the area hospitals. You've heard, but the benefits of breastfeeding are numerous. The American Academy of Pediatrics recommends 6 months of exclusive breastfeeding or breast milk feeding because mothers need to pump when they go back to work. Breast milk, baby's immune system, it helps a baby's immune system mature. Babies who breastfed have fewer and shorter episodes of illness. It benefits a baby's IQ, reduces childhood obesity, which can lead to hypertension and diabetes later on in life. And breastfeeding benefits a mother's health also. Because breastfed babies are healthier, their mothers miss less work and spend less time and money on pediatric care. With that said, it is very stressful for mothers to go back to work to begin with, Mothers need a place to pump throughout the day to maintain their milk supply and reunite with their babies after work. And they need a private place to do this, not a bathroom. You would not prepare food in a bathroom. It is also, it's an employee satisfier and a wellness benefit for the employee. It is my hope that you will pass this bill, which has lifelong health benefits to both mother and baby.
Our next speaker is Carol Mulligan.
Hi, I'm Carol Mulligan from Honey I Falls, New York. I've been a lactation consultant for about 20 years, and for most of that time I've been working in a hospital setting with new moms, helping them to establish the most important relationship of their babies' lives. We see new moms, moms who are breastfeeding for the first time, and we see moms who have breastfed before. When we talk to moms who have breastfed before, one of the things we're required to ask is, how long did you breastfeed with your other children? It's almost always, the answer is somewhere between 6 weeks and 3 months. And that's followed up with, I had to return to work. There are all kinds of obstacles for moms out there when they're breastfeeding. It's not an easy thing to do. We have never, as a species, known how to breastfeed. We've always needed help from other women. It's time for the community to be supportive as well. Monroe County needs to step up to the plate and set an example for area businesses. Like everybody else has been saying, it doesn't cost a lot. The return on your investment is great. So thanks for listening, and I hope you will consider this bill.
Our next speaker is Diane Cassidy.
Good afternoon. My name is Diane Cassidy, and I'm here also to support this bill. I am a lactation consultant. I work in private practice. I also work with moms prenatally. I have worked in the community as well in community programs with the underserved. So I have seen a lot of moms either prenatally having concerns with how they're going to be able to keep their breastfeeding relationship with their baby going once they do return to work. And I have also worked with mothers after they have gone back to work and listened to their concerns with, I'm not sure where to pump, I'm not sure how to talk to my employer about pumping. Also concerns with just being out in the community and not having a place to go to pump their milk when they're in places like the DSS building or the DMV or the local libraries where they can go to have a private space available to them. This would be a huge development for our moms. This would be a huge way to support breastfeeding in our community. And I really, really hope that with all the support here tonight, you see how important it is for us to be able to offer this to our moms. Thank you very much for your time.
Our next speaker is Gary Puttup.
Good evening. I'm also here to speak on behalf and support of the county policy to provide breastfeeding rooms for breastfeeding and lactating mothers. I do this from two perspectives. One is a taxpayer, and the second is a retired police officer. And I'm going to connect those in a second. One is a taxpayer because there are clearly economic benefits to allowing women to breastfeed, whether they're public or they're employees. Women get back sooner, they come back sooner to work from maternity leave. There's fewer sick days. There's all kinds of studies. There's all kinds of statistics I can give you. It is an economic benefit to the employer, and in this case, the county, to do this. In addition to that, as a taxpayer, the encouragement and promotion of breastfeeding also reduces cost, and that one of the things the county is responsible for is providing care to lower income beneficiaries, and sometimes that includes formula. Formula is very expensive, and breast milk is free. It also, again, as far as county and county taxpayers, with the reduced product or increased productivity in that from your female employees, it helps reduce county costs. As a police officer, I'm going to refer to some of the things that have been talked about here before. You can Google, there are a number of studies that show that children that are breastfed have increases in cognitive abilities and educational achievement. And I have a number of these here. You can find them for yourselves. And why is that important, both as a taxpayer and as a former police officer? Because kids that do better in school commit less crimes. We know this. There's more and more studies. There's enough evidence to show, ample evidence to show that this is true. If kids are smarter, they commit less crimes. When they commit less crimes, fewer people are going to prison and jail, which we pay for. There are long-term economic benefits to this. And if I may just conclude, gentlemen, I don't know if this mic is on, but if you vote against this, hell hath no fury like a woman scorned.
Our next speaker is Kathy Putup.
Good evening. My name is Kathy Putup. I live at 391 Melwood Drive in Greece, and I have a 33-year-old daughter who I'm happy to say I breastfed. I'm also a retired public employee. When I had my daughter, I chose to breastfeed, and making that decision was not easy. I understood all the benefits, but because I had no facilities to pump and store my milk, I had to delay going back to work. I was this because my husband had good income, and we had disposable income. Not every woman is in that position. I ask you to pass the breastfeeding and lactating room county policy. As a former public employee, I can attest to its importance for women. Thank you.
This concludes the public forum.
The next item on the agenda is the approval of minutes. You have the May 21st, 2014 minutes before you. They will stand approved unless the clerk is notified of any changes by the end of the day. Is there anyone else that is present tonight that would like to speak before this body that has not signed up? I didn't think so. Next item on the agenda is new business.
Referral 14-0205, Enacta County.
Sorry. Moved by Legislator Cayley, second by Legislator Barak. Before we go to discussion, I do want to acknowledge the sponsor of the referral and offer her the opportunity to speak on behalf of her proposal. I will let everybody know that I do intend to refer this proposal to the administration for further study. Legislator Andrews, you have the floor.
Thank you, Chairman Rocco. I appreciate the opportunity to speak to this measure. The proposal you have before you tonight for your consideration is relatively straightforward and simple. The intention is to promote breastfeeding as a public health issue in our community and to facilitate women, both county employees returning to work and then members of the general public, to breastfeed their children if they choose to. The proposal would create designated rooms in county-owned buildings wherever possible. It's not a mandate that it be in every single building if it's not practical, but to designate private rooms for breastfeeding and lactation. Certainly also the intent is not to limit women's rights in breastfeeding. They can choose to breastfeed wherever they would like. The idea here is just to have a private room available for breastfeeding and lactation if women chose to use that room and wanted to have a private facility available in our buildings. As we've heard discussed this evening, the health benefits from breastfeeding are very well documented and known for both mothers and babies. And we also heard conversation about how much easier it is for women to return to work when their employer facilitates breastfeeding. And I think we have an opportunity to do something here locally to support that cause. We also know employers benefit, as was also mentioned this evening, with less absenteeism when women return to work, fewer sick days used, lower medical costs, higher morale, higher productivity, et cetera. And just in speaking about this referral for the past few weeks, I've certainly run into a lot of people who've told me their private employers already have such rooms, and that, yes, they are used, and that they are appreciated by women in those companies. So there is already a law in New York that does require that employers provide unpaid lactation breaks to women upon returning to work, and also provide them notice of their right to request a room. We have asked that someone from the Human Resources Department be here tonight to answer some questions from my colleagues about how the county implements that policy. I know in looking to get ready for this conversation and in researching this referral, I couldn't find anything in the county handbook that discussed a woman's or the breastfeeding policy of the county, or on the county's intranet under the employees section, and I haven't seen any notices posted, at least in my perusal of this building, that talks about what a woman's right to breastfeed would be when she comes back to work. So if the county does have a policy, it's certainly not well promoted, and a lot of us are not aware of what it is. So having said that, I think that we do have an opportunity really to go further. In terms of which county buildings, I had envisioned the list that appears in the county's budget. I think it's under the, let's see. There's a list of 13 buildings in the county budget section. Certainly, I'm open to conversation about other facilities. And like I said before, if it doesn't work in a certain building because nobody works there, nobody goes there, or it just doesn't make sense, then we wouldn't have to do it in those buildings. In terms of the referral and the specifics that it asks for that be provided in the rooms, again, those are also open for the county executive to decide what makes the most sense, what's the most cost efficient, if there were to be any costs, and what fits in each building. The characteristics that are listed on the referral come from the U.S. Department of Health and Human Services, and they are their recommendations for breastfeeding lactation rooms, as well as recommendations from advocates who work in this field. So I was very pleased today to see a letter of support from Republican women in the legislature. I would be remiss if I didn't say that I think if this legislature were made up of more than 29%, or at least if 29% of this legislature, or more than 29% of this legislature were female, or there were one sitting on this committee tonight on the other side of the aisle, then perhaps this proposal could get passed this evening instead of just referred to the administration. I think referring it is a good first step. I would certainly ask that we get a report back within a month so that it doesn't dwindle and linger for too long without getting an answer back. And I just wanted to also address one issue in the letter that was sent, and that was the request that when the administration studied the issue, that it review existing demand for the room. I would just point out the fact that since nobody really knows or appears to know, or I would say generally speaking, there's not a room available now, it's hard to measure demand for something that doesn't yet exist. I think this is a case where if we were to have a room, then we would find demand. But not having a room, I would hope we wouldn't use lack of existing demand as a rationale for not implementing this. Because I think we have to have the room, promote it, and then we would see that it would be used. So thank you for considering it tonight. If it is referred, Chairman, then I would hope that you would ask for a report back next month so that we can move this along expeditiously. Thank you.
Very good. I appreciate the referral that you brought for us. I do find your comment about percentage of male and females pretty insensitive to us. You know, I didn't, you know, I'm just as sensitive to issues, male or female. So, and I think that was out of line. Is there any further discussion? Legislator Cayley.
Thank you. Thank you, Mr. Chair. I do have a question that I'd like to take from Legislator Andrews' comment and ask the administration through you to please explain the county's policy and procedures that are currently in place that were cited in the letter that we received. And I would just ask that, are you prepared to explain what the county's policy is now?
Through you, Mr. President, I checked in Mr. Chairman. I checked upon the request that I received late yesterday to see if I could get a representative from the HR department to be here. Unfortunately, there was a conflict and they weren't available. I will provide a written explanation of what the policy is because I am not the authoritative person on the subject. But my understanding is it is now that we meet the state requirements, which is to, on an as-needed basis, provide any employee that requests it the requirements that are stated that are outlined under state law, which is a private area, a surface to accommodate materials and to put things on, and a chair.
Thank you. And then I understood as-needed basis is what your understanding that the county is currently doing.
Which I believe is what the state requirement is.
All right, thank you. Did you have any questions?
Any further discussion?
I do.
Okay.
I do, sorry. Just
I saw
thinking
you-
as a result of an answer, that's all. I would like to say that I'm pleased that the legislature has allowed this referral to come forth, and I am very happy that it is moving forward. I'd prefer it not to be referred and to be voted on. I think that it merits being passed at this point, but that said, it's still a good point. We're moving in the right direction. I wouldn't give as much credence to the letter that we received with regards to existing demand. And I agree with Legislator Andrews when we talk about existing demand that it's extremely difficult to measure when you don't have what I believe to be an informative policy that perhaps it does meet the extent of the smallest amount of New York state law, but certainly not in a very pronounced way. And in saying that, this referral, we do need to look at the cost and the feasibility. I understand that. But in terms of demand, I think as a county that it's reasonable to assume that the citizens of Monroe County and those that visit Monroe County and visit Monroe County's buildings will procreate with or without this room. But the main fact is that families are being built as we speak, and the need for these rooms are there, and therefore we should be prepared rather than behind the eight ball when it comes to as needed. And I would hope that there'd be more thought to that particular reason to have one of these rooms in every building that we could possibly put them in. That the need will always be there. The need that we have now is to communicate that we would have the facility and that it would be there ready for people to be able to use. The health benefits have been proven, the economic benefits have been proven, and it's time that we go beyond just meeting the minute letter of the law in Monroe County. Thank you.
Any further discussion? Legislator Tucciarelli.
Thank you, Mr. Chairman. First off, I'd like to thank the speakers who came out tonight and provided us with important input. All members of this committee have received a letter from 4 members of the Republican caucus, which provides some additional information and input for this committee. I appreciate their thoughts, and I'm sure that the sponsor of this referral does as well. I will add my support to the intent of this referral, and I share the same concerns addressed in the letter we received: the cost, demand, and feasibility of creating such rooms in every county-owned, operated, or leased facility. At this point, Mr. Chairman, I will ask that we refer this proposal to the administration for further study. I specifically ask that we look at the following: 1, current policies and practices concerning breastfeeding for county employees; 2, a list of facilities that this referral would apply to; 3, an estimate of the cost for this implementation of this program within those previously listed facilities; and 4, a study of the demand for these facilities by both county employees and the public. I believe with this information we'll be more informed and have a better understanding of exactly what is asked here in this referral and how it will impact the costs and the taxpayers of Monroe County. But I do support its intent. Thank you, Mr. Chairman.
Thank you. Legislator Broth.
Thank you. First, I must say I'm glad to be back. I was actually on Agenda Charter a couple years ago, and I'm back again. So I appreciate being here, and thank you for the opportunity. First, I do want to point out, this is an item that I think is of particular importance, and I want to make sure, and I think, Mr. Chair, you'll agree, that this is an issue that actually affects all members of the population, male and female. I mean, we all either have thought about, might think about, or have thoughts positive or negative regarding children. As a father, I actually had a lot of experience with the trials and tribulations of breastfeeding and lactation, particularly lactation, because there's a lot of issues around that. It's not so easy all the time for some, particularly if you don't have access to electric pumps, which can be very subtle and very unpublic. But if you have mechanical ones, that's much more challenging. So I just want to point out this is an issue for everyone, who has any sort of anything to do with our culture in general. In other words, everyone in this room and everyone outside this room. I realize that this referral is, in fact, well-intended. I'm glad that everyone in this room appears to realize that as well. And I think it's also very well written. In particular, I like the fact that it allows for the county to determine what is, in fact, reasonable and what is, in fact, I guess we would say, affordable. I was really pleased to hear one of the speakers, I believe that was the CEO, I want to say child care advocacy, I could have the wrong person, but talk about the prices. In fact, you're talking about buying a chair, you're talking about buying shelves and things like that. I recognize the administration is going to be looking at perhaps other unseen costs that we might incur, and I think that's reasonable if this gets referred. I would have a formal request to make through the chair to the administration that we receive an update at the next agenda charter meeting regarding either the thought process behind the 4 items that my colleague across the item just mentioned, and in fact, if they have any suggested amendments or modifications to the referral as written. I would hate to see the referral as a whole be challenged or put into question simply because one aspect of it is deemed to be overburdening. And I don't expect that to occur, but if it were to occur, I would expect the administration would have an alternative or a suggestion that they can make either to the body as a whole or to one caucus or the other caucus. I'm quite happy to see this come through one way or the other, but I want to make sure we don't just simply say, this is too difficult, let's throw up our hands. Because I think, frankly, we all agree, and I'm looking across the aisle on my side of the aisle, that this is not a bad idea. This is a very good idea. In fact, it's a legally responsible idea in terms of state law. So I would urge, formally request through the chair that to the administration that we'll hear back at next month's meeting regarding where the referral process is going. And I'd like a response if that's possible.
I'm sure that'll...
Through you, Mr. Chairman, we will, some of the issues that are being brought forth will be obviously, far easier to answer than others. I think that we look at Legislator Cayley's request for us to simply provide what the current policy is. That's not going to take any time whatsoever. As far as what would be required and the time necessary to ascertain what buildings may or may not be covered and encompassed into the policy and the cost involved in that may take more time, but I think we can update you as to where we are with regards to that. Whether or not we'll have that finalized in a month, I can't promise that.
Well, through the chair of the administration, you could, however, and I'm not requesting a final report, obviously, because it's a process, but through the chair of the administration, an update on where the administration is in developing that report, specific aspects of it. So, for example, you mentioned the request for current policies. Clearly, you could give an answer to that in a month's time, correct?
Oh, I would think we would probably provide that in a matter of days.
A day's time, yes. So through the chair of the administration, I'm just request that we hear back on all 4 where we're at in terms of the process being moved forward for either analysis or whatever it may be the administration chooses to do.
we'll attempt to get you the best information that we have at the time that we meet again next month.
Thank you. Is there any further discussion? Being none, now this has been referred to the administration, correct? This is where we leave this lie. Very good. Are there any other matters to come before this committee tonight? There being no other matters, the June 25th, 2014 meeting of the Agenda Charter Committee stands adjourned. The next meeting of the Agenda Charter Committee is scheduled for July 30th, 2014 at 5:30.